If you or someone in your family needs dental implants, there is no need to put it off any longer. Dr. Heath Lampee with Teeth in 24 can perform full mouth restoration in a very short amount of time and can help you overcome any obstacles that might be in your way. And he joins me now. Hi, Dr. Lampee.
Hey.
Okay, so just give us a brief overview of what you do.
So Teeth in 24, I've done this for almost 20 years in the same location with the same team. Patients come in, we need to figure out, can we save their teeth? Can we not save their teeth? A lot of my patients haven't been in 5, 10, 20 years because they're terrified of the dentist. I totally get it. And so for my patients that we can save their teeth, we can crown and veneer their teeth, resurface them, make them look beautiful again, straighten them, get rid of all the ugliness basically. Now for my patients whose teeth are too far gone, too much gum disease, too much broken teeth, too much cavities, we have to take them out. All in one day, we take them out, put in implants in, and they get brand new permanent teeth that day. I do all the work myself with my team. There's not some other guy that shows up for surgery or anything like that, like, hey, no, it's me.
Yeah.
We control the process because there's so many nuances to this to make it beautiful, to make it easy. My laboratory is also on site. We make everything there. We can control the process. So patients wake up with brand new smiles. They don't have to hide their smile anymore. And it is amazing to see that transformation.
Yeah, and one of the barriers that people coming in is that they think this will take too long. Maybe they'll be without teeth for longer than they want to be, but that's not the case at your office.
No, we're not playing that game anymore. There's no dentures, there's no partials, there's no missing teeth for days or weeks or months or anything like that. It takes my lab just a few hours to make these new permanent teeth. And they are gorgeous. They are gorgeous. Now, one thing we make sure, a lot of my patients, they don't want their teeth too big. They don't want them too white. They don't want to look like horse teeth chiclets. And so we customize everything to the patient's face, also to what the patient desires. Some people want really white. Some people want yellow teeth. We can change all this. I've got a couple patients that want crooked teeth. We can do anything.
Sure.
And so that's what's so cool about having the lab on site, is to make sure that each patient gets listened to, heard, that everything is tailored for that patient and their face to make it natural.
Yeah, and another barrier that people think they have is that they might not have enough bone to do that implant, right? Because you kind of attach it to their existing bone, but you say that's not always the case either.
Correct. So I'm an implant specialist. There's not that many of us out there. My skill is very high. And so I have so many patients, especially patients that have partial dentures. Those are those things that you hear about you don't want. And they've gone to other places and they've been turned down. You don't have enough bone. You don't have enough bone. And with our advanced techniques, we can put implants pretty much anywhere that we need to, bottom, top. And for these patients that have had dentures, debilitating dentures or partials for 10, 20 years, this is life-changing.
Yeah, and it's not just about the smile either. It's about overall health, because those can also cause infections, which can cause infections throughout your body, right?
Yeah, so what we're finding even more is that all these chronic infections in the mouth affect the immune system, they affect the heart, they affect autoimmune disorders. It's also why orthopedic surgeons want healthy mouths before they do new knees, new hips and all that, because that bacteria can get into your bloodstream. And so many of my patients, they say, Dr. Lampee, it doesn't hurt. I'm like, I know it doesn't hurt, but your immune system is constantly fighting these bacteria. These are nasty bacteria that thrive in a dark, oxygen-free environment, and they are nasty bugs. And so by getting the teeth out, doing our implants, the bacteria go away. The only reason the bacteria are in your mouth is because those infected teeth are in there. Once I physically say goodbye, bye bacteria, they don't come back. And so that's why this is life-changing, not only for your smile, but also for your health.
Yeah, and one of your patients, Terry, kind of had that experience. So tell us about Terry.
So Terry's about to retire. She's worked hard for 30 years. She's a new grandmother. She wants to be able to smile at her granddaughter. She doesn't have to hide her smile. She's got broken teeth. She's got pretty bad gum disease, so we have a lot of those low-grade infections. So she wants her, the next 30 years of her life to be healthy and happy, and she's an extrovert. She loves to be with people. And so we realized we couldn't save her teeth. So we had to with one day with sedation, she's sleeping, we take the teeth out, we get all the infections out of there, we put implants in, and we give her that brand new permanent smile that afternoon made by me and my laboratory. And she is the person she wants to be now. She is loud, she's laughing, she's going out, she's smiling at her granddaughter, she babysits her granddaughter all the time. And for her, it was one of the best things she's ever done because it really allows her to shine in her extroverted self.
Yeah, oh, that's great. The success stories are great. So if people want to take that step, if they're ready, how can they contact you?
They can call us at 503-646-2273. They can get on our website, drlampee.com. They can see me talking about some of the technical aspects of our work, but also they can see some of what our patients say and what their lives are like after the procedure. And these are all real people with their real stories, and that's what's so exciting about this work.
Well, thanks for stopping by and sharing with us
Thank you
today.
so much.